Pain is good. Today we're going to talk about why this is true. Hello, my name is Jay Armstrong, and welcome to the Movement Pro. No one likes pain, and it is my mission to help you be the most athletic and pain-free person possible. Perhaps one of the first steps to achieving this goal is to understand what pain is and to not only accept it, but to embrace it as your friend. Yes, you heard that correctly. Pain is your friend. Let's begin by talking about what pain is. Pain is a creation of the brain. And yes, that does mean that the pain is in your head. But this doesn't mean that you're imagining it. Your pain is absolutely real. It's just that pain is a result of your brain processing a variety of sensory inputs, filtering them through your prior experiences and your cultural perspectives, and then creating a pain experience. There are other factors that are involved in the pain experience too, such as emotions, prior exposure to the particular type of pain you are currently experiencing. There are two very different types of pain. One is acute pain, and the other is chronic pain. Acute pain is associated with trauma. So imagine that you hit your thumb with a hammer or you cut your finger with a knife while slicing the onion. The ramifications of both of these events are usually an immediate awareness that you did something you would rather not do again. Possibly bleeding, bruising, pain. And after your self-destructive incident, your body will begin the healing process. And after a few days or weeks, you will be good as new, and there will be no lingering pain associated with this event, except maybe a bad memory. Chronic pain might or might not have a specific event that marked its onset. Usually, a client will come to see me with chronic shoulder pain or some other body part, and will simply announce that the pain has been getting worse for months or even years. He usually doesn't recall why or when the first pain actually appeared. If he has been to the doctor, he was probably told that he has arthritis or that he's just getting old. Although these types of pains, chronic and acute, are very different, modern medicine often treats them similarly. This is most unfortunate for you. Let's return to the shoulder pain example. If you fall off of a turnip truck and smash your shoulder into the pavement, you might have a traumatic injury of either soft tissue or bone. You may break a bone. It is highly likely that you will have pain. And here's the really great news. We have the very best emergency care facilities right here in the United States and some of the greatest trauma surgeons. It is very likely that you will enter into the hospital, receive some care, possibly including surgery, and then you will begin your recovery. Your tissue will heal, you might go through some movement rehabilitation, and eventually you will be returning to your normal life with a pain-free shoulder ready to fall off the next turnip truck. Now, what about the poor bloke with the chronic shoulder pain? He goes to the primary care physician who does a thorough examination and cannot find anything worth note. So, he tells the patient he has the following things to offer. 1, pain medications and or anti-inflammatories. 2, a recommendation for RICE, rest, ice, compression, and elevation. Or 3, a referral to a shoulder specialist. Now, our dear chronic pain patient is at the end of his rope and accepts the referral to the shoulder specialist. After all, he's been in pain for a long time, remember, months or years, and the painkillers have not improved the situation. It's only masked it. Now, our hero in pain shows up at the shoulder specialist's office. The shoulder specialist orders an MRI. that clearly shows degenerative arthritis. Here is what our shoulder doctor offers the patient. 1, pain medication and/or anti-inflammatories. 2, a recommendation for RICE, rest, ice, compression, and elevation. Or 3, shoulder surgery. Now, perhaps we have a problem here because our shoulder specialists make a lot of money from shoulder surgeries, and therefore he pushes this option. But I prefer to believe that we have a problem with the system. The options presented to the patient are the same ones he has heard before, except for the one about surgery. And now there is absolute proof in the form of an expensive MRI that says he has arthritis. Therefore, the patient believes surgery is not only a viable option, but it is either the best option or his choice of last resort. He probably sees that there is no other option for reducing the chronic pain he has been enduring. Let's learn to differentiate between these two types of pain. In the case of acute pain, the brain and the body are telling us to stop doing something immediately. Thankfully, the brain spoke to us through this pain mechanism so that we knew for certain that we should stop pounding on our thumb with the hammer or stop slicing through our thumb with that knife. Imagine what would happen if we didn't have an associated pain experience. We would simply continue with our self-destructive behavior. We learn at an early age that putting our hand into a fire is a bad thing. We learn this through pain. It is a very valuable lesson. In this case, pain is not a bad thing. It is our friend and our teacher, and we should appreciate it and its lessons. Pain, in the case of the chronic pain, exists for the same reason, to teach us. If we can learn to listen to what our body is telling us, we can decipher what it wants us to do to reduce the pain and what it wants us to do to avoid in order to stop exacerbating our discomfort. Pain, again, can be our friend and our teacher. The strange disconnect is that we usually treat acute pain and chronic pain quite differently in our modern society. If I have a traumatic injury, I trust my brain and body to accurately inform me about the pain. We know that we should stop the bleeding and avoid these types of injurious activities. We might go to the doctor if the damage is beyond our skill set, but we still trust ourselves. In the case of chronic pain in the 21st century, we have no belief in our abilities. We don't see any bruising, bleeding, broken bones, so we can't justify the pain. We don't want to do the work to figure out what it means, so we defer to the physicians. We're not qualified to think for ourselves. This is strange. Our previously mentioned client had been ignoring his shoulder pain for months or years. Clearly, he was qualified to do this. Quite commonly, the cause of chronic pain is lack of movement or compromised movement skills. To address either of these issues would require our client to accept responsibility for curing himself. Our client usually does not want to hear this story. He wants to go to the doctor. The pain problem our client has is actually the doctor's problem. No, it is not. Learn to listen to your body. You must move. You must look for and correct compromised movement patterns. You might need to search. You might need someone to help you search, but you must do the work. When it comes to chronic pain, you can make a huge difference if you, 1, accept responsibility for your own movement skills, and 2, make pain your friend and your teacher. To learn more about how pain and movement are intertwined, join me on June 6, 2020, at the Kettlebell Club in League City, Texas for a one-day workshop, the Movement Pro Mobility Certification. Visit www.kettlebellclub.com to register for this incredible event. See you next time here at the Movement Pro.